So welcome everyone. My name is Gerry Rosberg. So glad to have you back for another in our series of webinars on issues involving the vaccine, the mandate, the return to campus, and all the rest. We had a brief interruption since the last time we were all together, but we're glad to be back with you and appreciate that so many have come here to join us and hear. There's a lot to talk about today, as you're going to hear. Lots of developments, even late breaking news from CDC. There's much to be said about the variants, the mandate. We've got a survey for you. We've got a contest that's underway that we're going to talk about. The plan, as always, is our three-star panelists are here, Donna and Wafaa and Melanie, and I'm not even going to try to introduce them, because my feeling is that at this point, if you don't know who these three people are, it's simply too late for you to catch up. So trust me, you're hearing from the people who really know what they're talking about. And I'll turn this over to Donna for the start of the program.
Great. Hello, everybody. And we're going to share some slides to kick it off. Great. You can advance the slides. Perfect. I want to give you a little bit of a snapshot. It's going to be brief about where we are in the US, but also where we are here clearly in New York State and New York City in terms of both COVID and in terms of vaccination. You can go to the next slide. So you've been hearing a little bit, I'm sure, in the news about increases in COVID positivity across the United States and in New York State and in New York City. And so just to give you a little bit of a snapshot, you can see that COVID positive cases have been increasing over the last 14 days. The hospitalizations are increasing, but if you notice the change, it is much less significant. So this is a sign that while we're seeing more positivity, we're also seeing many fewer people who are being hospitalized and also who are dying. And that's true when you look at the New York State numbers, again, going up by roughly the same percentage, although New York State is in much better shape than many other states around the country that you may have heard about, like Florida and Arkansas and Missouri. Excuse me. So again, much lower increase in the number of hospitalizations. We're seeing that up here on the medical center campus and across NYP. You can go to the next slide. This is the longitudinal map of where we've been since, March was our first case here in New York State. This is the this is the United States data in terms of cases. And obviously we are concerned, if you look all the way out to the right, at what has started to happen really right around July 1st. And that line upwards shows you the increase that we're seeing. A little bit of a hopeful drop, but I think you should get used to hearing that we're going to continue to see some positive cases. And hopefully with the vaccine mandate that we're going to talk about, though, these are cases that are not that serious and resulting in hospitalization or in death. You can go to the next slide. And then this is just to give you the same sense about New York. So again, the two peaks that we've had in New York dropping way down into June. And again, just actually a much smaller upswing, although New York is in one of the categories that the CDC just decided on today with respect to the recommendation to add face covering back for people even who are vaccinated. You can go to the next slide. And then on the vaccine side, we have a lot to celebrate, but we also have a way to go. In the United States, they're closing in on 70% of adults having had one dose. Here in New York, we're closing in on 75%, which is great. And as you often will hear Wafaa say, but that means 25% are still unvaccinated, and we have quite a bit of work to do. You probably have also heard the mayor announcing that he is mandating it for city employees, some beginning as early as next month, the majority in September. You can go to the next slide. There's some real variation across the city. The darker blue represents higher rates of vaccination. The differential between the worst zip code areas and the best zip code areas is in some cases in excess of 20%. So that's very concerning that we try to reach out to those neighborhoods to get people vaccinated. But you can see Manhattan, the very small exception is almost exclusively dark blue. You can go to the next slide. And that's it. I'm going to turn it over to Melanie, who is going to talk about compliance and what we need you to do over the next several weeks.
Great, thank you, Donna, and good afternoon, everyone. You can just get the slides up. I will give you a few key reminders in terms of compliance and dates and so on. So here we go. Great. So this is really the checklist. There's a lot of dates, so I'm just going to run through each one and then give you some more details. So August 2nd is the date we've all been talking about, which is compliance with the university's vaccination requirement. What does that mean? That means by August 2nd, we ask everyone in our community to get their vaccine, upload the documentation, again, for faculty and staff through the Reopen CU app, for students through their student portal. So upload the documentation or apply for a medical or religious exemption, all by August 2nd. So just a reminder to get that done. Then August 16th is the next deadline. That's signing of the compact. And many of you may not have even noticed this change. Even if you signed the compact already, that has reset for everyone because the compact has been revised. So if you go onto your Reopen CU app and scroll down to your checklist, if you haven't looked at the new compact, your little checkbox will be unchecked, even if you had signed it previously. And if you've never been on campus, it remains unchecked. That is something you can do right through the app. You click on the little link there, you read the new compact and you attest to that, and then you will get that checkbox back. But again, if by August 16th that's not done, that is going to be linked to a red pass. The next deadline is September 1st, and this is the new training. If you have been on campus and accessed campus anytime in 2020 or the winter or spring or summer of 2021, you will have taken the training and you don't need to repeat that. But if you're new to campus, there is a new and updated training that needs to be taken by September 1st. And then the final deadline is the testing deadline, and that will be September 9th. And I'm going to run through what testing looks like and what the testing requirements are. So the next slide, please. So the first piece to meet that requirement is the gateway testing. Anyone who's not accessed campus and had a test on campus in 2021 is required to complete what we call a gateway, a re-entry, an initial test on campus. If you've done this already, as I say, had any test with us during 2021, you don't need to repeat that. It has to be done at one of our Columbia University sites, and it is by appointment. We don't accept walk-ins for those. So the appointments for that are made through the Secure Health portal, secure.health.columbia.edu. For anyone who's fully vaccinated, you can now access campus on the same day as you get your test. So you don't have to make a special trip. You won't have a red pass that doesn't allow you. So if you're fully vaccinated and you're coming to campus, do that test the same day. But if you are unvaccinated, we ask that you complete that test prior to your return to campus. And for our students, we're having them quarantine while they await that result. So that's the gateway test, and that's what needs to be done by September 9th to get that checkbox. Next slide, please. Then just a reminder about the ongoing surveillance testing, and this will be the change in the fall. That everyone who is fully vaccinated will continue to participate in our surveillance testing program. That is going to look like, that is going to be random sampling of everyone who is vaccinated. So a small percentage each week will be sampled and asked to test, and that is a requirement. So if you are sampled, you do need to test to keep that check mark on your app and keep access to campus. For those who will receive a medical or religious exemption, or for those students who are completing their vaccination, they will be getting weekly testing. And then the final piece of the surveillance is the wastewater surveillance of the undergraduate residence halls, something we've been doing all year. And if we detect a COVID-19 spike in the wastewater, every building resident gets tested. And the next slide, please. So this is just a graphic, we've probably shown this before, which kind of shows the changes we anticipate as we go through these various stages as regards masking, distancing, and testing. We are still in that first stage until August 2nd because we don't know the full vaccination status of our campus. whereby everyone is still distancing, the fully vaccinated is still masking indoors and not outdoors, and everyone is participating in our surveillance testing. The difference for those who are unvaccinated, if they are exposed right now, they also have to quarantine if they're a close contact. If you're fully vaccinated, even now, and you are exposed, you are not required to quarantine. You just monitor for symptoms. Then what we anticipate happening, and again, I do say anticipate for all of this, this is all subject to change if the situation is to change, but we anticipate after that August 2nd date and until September 8th, we have a somewhat mixed population, and those who are fully vaccinated will continue to mask, but will not need to distance indoors. That's going to be the biggest difference there. And then if all goes well, beginning September 9th, we may be able to lift the masking requirement indoors for those who are fully vaccinated. I've already described the testing, but anyone who is unvaccinated will continue to require masking, the mandatory surveillance testing, and quarantine if deemed a close contact. Again, I do want to reinforce that this could change if there are any changes in the prevailing public health underlying circumstances. With that, I'm going to turn it back to Donna.
Great, thank you, Melanie. And we're going to get to Wafaa in a minute, who is going to cover a variety of issues, including booster shots, the variant, and today's announcement from the CDC. But I do want to mention two things. One, first of all, we have over 1,300 participants, so thank you all for joining. And second, although some of you have dropped questions into the Q&A box, that is where you can put questions. We'll be typing as others are talking to try to get to them. And again, we'll answer as many as we can. And at the conclusion, take a look at the ones that we couldn't get to and make sure our FAQs cover that. So we're going to switch for a second because Melanie gave us quite a few reminders. And we do want to just check and see how much you're really paying attention to all these reminders, as well as some other things that are going on. So we have a very short quiz that we're going to ask you to participate in. So Robert, please take it away.
So can you all see the poll?
We can see it, and please start answering the questions. Robert, I think we can go, and thanks to everybody, because some of these are not true or false, as you can tell, or testing your knowledge, but they're giving us information on why it is we may not be seeing the kind of compliance with the mandates. So great. On number one, have you been vaccinated? We have 97% of you, so thank you for that. And 95% of you have been uploading or have uploaded the information into Reopen CU. It looks like, and we were just concerned, when I think about this poll about a month ago, there were some people who were having technical problems with the Reopen CU app and with the web, and we fixed those. There were many, many more that just hadn't gotten around to it. So thank you for giving us that information. And again, with 98% of you saying you intend to upload it, that means that I will tell you we are not at 98. You are a unique audience, because that is not the number that we have for the entire campus, which is why we're trying to get at some of the underlying causes. We're at about 80% across the university, a little less than 80% across the entire university. Gateway tests, so some work to be done. Again, some of you may be 100% remote or thinking you're 100% remote for a period of time, and as long as you're coming back and getting a gateway test, that would be helpful. All right, Robert, thank you very much. Again, a short poll. We're going to turn it over to Wafaa, who is going to go into a lot more depth, and we'll continue to frame up the Q&A. Thank you.
And thank you very much, Donna, and thanks to everyone. I'm going to share my screen. I think it's, can you see it? Okay, great. Thank you.
Wafaa, you need to go on slideshow, though.
Oh, boy. Okay, sorry, I'm going to try again. It worked before. Okay, let's try this one. How about now?
Yes, perfect.
Okay. Thank you. So this is an outline of my quick presentation. I'm going to start first by touching on the virus variants, particularly the most important circulating variant, which is obviously the Delta variant. Talk about vaccine effectiveness, particularly with regards to the new variants, the Delta variant. I'll touch on booster dosing and tell you what we know thus far. Then I'll talk about the pandemic status and then touch on the CU monitoring plan that we have put in place or have a draft on and that we put in place and considering for the fall. So let's start with the variants. So as you're well aware, what you've seen is that in the United States, there's a new variant here at this point in time, July, a new variant that's predominating amongst all the viruses that are sequenced across the country, and that's the Delta variant, which was first, of course, identified in India. If we look at New York City, we see again, similarly, that here, you can see here this light blue, this is the Delta variant. And you can see that at this point in July, of all the viruses that are sequenced by the city, you'll see that the majority of the variants are from the Delta variant, and this has been growing over time. Now, in terms of what's the effect on terms of vaccines, there are three ways in which we try to examine and assess whether the vaccines are still effective against the variant. And one of them is by looking at the antibody levels, and those are produced by our immune systems. And the data have shown that these antibody levels are pretty good at predicting the immune protection from vaccines. So that's good news, meaning antibodies are informative, and those are much easier to measure as a means of deciding whether the vaccine continues to be protective or not. And you can see here in this figure, there's this very nice correlation between the vaccine efficacy and the antibody levels. But more importantly than just the antibodies are real-world experience in terms of how does the vaccine work, essentially, among people. And here we look at a variety of different countries, England, Scotland, Israel, and Canada, and just focus on the solid lines. And the solid lines are for full vaccination, meaning 2 doses of vaccines that require 2 doses. In blue is Pfizer-BioNTech, in red is AstraZeneca, and in green is Moderna. And you can see here, this is 100% effective, is that even with the Delta variant here, is that you can see there's these different studies from these different countries show, with the one exception here being in Israel, that there's maintenance of protection against the Delta variant. There seems to be a bit of decrease in terms of the protection levels, but nonetheless, it's still pretty high. Even the lowest here is about 60% protection. And this is against symptomatic infection. Very importantly, these vaccines were developed or were measured in terms of their prevention of symptomatic disease. Okay. And then when you look at the efficacy against hospital admissions, and here we have data again, England, Israel, and Canada, and you'll see that now the value of these vaccines, that even though symptomatic infection with some may have decreased, there's still a very highly protective effect against hospitalizations. So that's really also good news, and it amplifies what Donna mentioned in terms of the vaccines appear to be, again, pretty solid protection against the ones here that were studied against severe illness and hospitalizations. So let me shift now to booster dosing, and this is an important topic. And there are 2 kinds of what people call booster dosing. There's the whole concept of if people, for some reason, are immunocompromised or older age individuals, do we have evidence that these individuals will need an additional dose of the vaccine that they've received before? There's also people use the term booster dosing for another scenario, and that by that they mean, will people be required to get a shot of a different vaccine that's produced against new variants? What we are focusing on here are what I'm calling the 3rd dose vaccination. So this has come up because, of course, there's some individuals here in these studies that are recipients of, have had a solid organ transplantation or people on hemodialysis. And these are 4 studies that have looked at exactly this question. And you can see that the sample size in terms of the numbers of people who participate in these studies is quite limited still. But nonetheless, you can see here that amongst the people who had not shown any antibody against the virus after the second dose and then received the third dose, you can see that there was an increase among them in terms of positivity. You see in this group up to 44% became positive, meaning they have antibodies, 33%, 42%, and 50%. So what this is telling us is amongst those who had no detectable antibody response after the initial 2 doses, in this small series of patients, that about between 33 and 50% developed an antibody response after an additional dose. The CDC had a meeting last Thursday to discuss these data and more data, and there's now under consideration whether they will recommend that individuals who fall into this category, whether they need a third dose. So stay tuned. And this again shows here the same thing. This is the level of antibodies after, before the third dose and after the third dose. And you can see the increase in the proportion of people who then were able to mount antibodies after the third dose. In terms of the safety of getting a third dose, and that we call that reactogenicity. And here you can see, for example, pain at injection site after the second dose versus the third dose. Not much of a big difference in terms of the pain at the injection site. Similarly, when you look at fatigue, second dose, third dose, and so on and so forth, that again, it appears that these individuals tolerated this third dose quite well. Okay, let me then shift to update you on the complexities of the pandemic and the pandemic status. So as Donna mentioned, of course, is that we are now experiencing, this is in the United States overall, an increase. You can see it here in the tail here in the numbers of cases. However, when you look at this map, which shows the case rates in the past week, you will see that certain parts of the country that light up in red here are the ones that are experiencing this high increase in numbers in terms of numbers of cases. This includes Florida, you've heard about that, as well as several states here in Missouri and Arkansas, Louisiana, and so on. And what's interesting is that we see, again, this increase in numbers of cases, but there's a disconnect overall in the country with fewer hospitalizations and fewer deaths overall, with the exception of what's happening in these states that I just mentioned. And you will remember that these states tend to be, again, low vaccinated regions of the country. If you look at New York City, we see the increase in numbers of cases that we've seen and Donna mentioned, but we see the same disconnect again with flat, almost flat in terms of hospitalizations and death. So we are seeing in highly vaccinated parts or better vaccinated parts of the country, this important disconnect between numbers of cases and the hospitalizations and death. And this is largely because of vaccination and the efficacy of the vaccines against severe illness and hospitalizations and deaths, which is really good news. And again, this shows you again, the darkest green is the parts of the country where we have more vaccination here, up here, and then other parts of the country where we have low vaccination rates, as I showed you from the prior map. This is a very interesting map, and it combines two things. It combines the US case rates versus vaccination rates. So in the darkest green here are parts of the country that have highest percent of people who are fully vaccinated and also with lowest numbers of cases. And you can see that in the Northeast, for example, is an area that's distinguished by higher vaccination with higher vaccination and low case rates. This contrasts with Missouri and Arkansas that I mentioned before, which tend to fall into this part here. And these are places where they have low vaccination rates and high numbers of cases. So we are seeing this, again, disconnect that I mentioned before due to vaccination. And again, this is shows you other data, and the data are interesting. This is in the US overall in terms of hospitalization deaths and vaccination status. And the beginning of July, over 99% of recent deaths and approximately 97% of hospitalizations in the US were amongst individuals who are unvaccinated. So that's really important. And if we look at New York City by vaccination status, we see a similar pattern. You can see here the percent of the cases. This is from January till middle June. And you can see here that amongst the cases that have been reported, that the vast majority, 98.9%, was amongst those not fully vaccinated. And then you can see 98.4% were of the hospitalizations were among people not fully vaccinated. And similarly, 98.9% of the deaths were amongst those not fully vaccinated. So there is an evolution in this pandemic, and this is what we're calling kind of a new narrative, a new reality, and includes the following, and it is that vaccination remains our best shield against the COVID-19 pandemic, with, of course, the importance, again, of some of our usual protective measures, and we'll talk about that. That vaccination coverage is defining the risk for communities and individuals. And individuals that are fully vaccinated are consistently been shown to be protected against severe COVID-19 and COVID-19 related hospitalizations. But I want to remind everybody that individuals who are fully vaccinated can get infected, although there's a reduced risk of infection. And usually these infections are asymptomatic or mildly, moderately symptomatic. And also that we have data that shows that such individuals, even if they get infected, they tend to be less transmissible or less likely to transmit to others. And as I noted before, in vaccinated communities, there's this disconnect that's been observed between the numbers of cases and the hospitalizations and deaths. And this has been observed both in the US overall, as well as in our own city. So I think we're evolving from a situation where we have, this is a pandemic with a lot of cases. This is what it used to be like before we had the vaccines. And now with the vaccine availability, the world is kind of unfortunately dividing into areas of the world, including in parts of the United States and New York City, where the virus in all likelihood will become endemic rather than epidemic. So we're distinguishing between areas where there's high vaccination rates, where endemic means that there's continued transmission, albeit at a lower rate of transmission, certainly than areas of the world where there's very little vaccination. So I think it's important to keep in mind that I think the idea that the vaccines or that would eliminate or eradicate this virus are really not realistic, is that ultimately what we want to do is to decrease the numbers of transmissions as low as possible and to prevent illness, disease, and disability. Now, Colombia, we've been working on a framework for COVID-19 risk assessment and management for the fall. And this obviously is evolving because the data evolve over time. But just want to share with you some of the metrics that we are monitoring and plan to continue to monitor, both for New York City overall as well as for Colombia. So for New York City overall, obviously very important is the New York City vaccination coverage. And this is in order of priority. Secondly would be COVID-19 hospitalization. Thirdly, the numbers in deaths in the city. And then lastly are the numbers of cases. And this is because, again, now these two are much more important in terms of determining the severity of the situation overall. In terms of the Colombia metrics, again, in the order of priority, again, the vaccination coverage at Colombia, as well as the PCR positivity rate in the random sample, which Melanie mentioned to you. This is the random sample amongst those who are vaccinated, which we will do starting in the fall. And then, of course, the PCR positive individuals, will keep an eye on that as well. And this is in the non-random sample as well as based on external testing. And we're defining risk levels, lower risk, low risk, moderate and higher risk. And we are putting together some of the actions that would be taken for each of these levels. This is work in progress, and once it's finalized, we will post this on the web so everybody will have access to the information and to our framework. So in conclusion, I think that COVID-19 vaccination is a critical tool to prevent transmission and control this pandemic. We're seeing disparities in vaccination, and that's unfortunate within our city and within our country. There are encouraging data accumulating the effectiveness of vaccines against this virus, against this variant, which is a dominant variant in the US. And whether further doses are needed, especially in immune-compromised and older individuals, remains to be determined. And the pandemic is evolving with unvaccinated communities, high rates of cases and severe disease, vaccinated communities with more of endemic COVID-19 with fewer cases and low hospitalizations and deaths. And as I mentioned, we are developing a monitoring plan, which we will share with all of you in the next few weeks. So I'll stop here.
Great. Thank you, Wafaa. That was amazing. And you covered a wide variety of topics, some of which are in the Q&A box. First, I just have to apologize and make the audience aware. If you did have a problem, we were wondering why it was so easy to submit your information, and apparently we had a little glitch in question number 3, so we apologize. We're going to look into that, but feel free if you are experiencing a problem in submitting your information, or there is some reason why you haven't done it, you can add it as an anonymous person into the chat box, and it helps us, again, understand what we need to do. We've been answering, Melanie and I have been answering questions, I think, throughout. We've gotten through about 78 of them, but I'm going to run through, there are many more that are still open. And I'll start with Wafaa, because there has been some literature. You mentioned some of the literature, and I may have missed this because I was thinking about answers, but the Jensen vaccine or the J&J vaccine, their question is it enough for the variants, and should we take another one if that's what we got several months ago?
Yeah, and that's a very good question. We have some data that show that the response, these protective levels appear to be a bit lower. We don't know the clinical implications of this, and we are awaiting further data and from other studies to make a determination in terms of whether if another dose would be recommended, or whether the safety of giving another dose of a different vaccine in people who already received the J&J vaccine. So I think, again, this is evolving by the minute, so stay tuned. Yeah.
Great. Thank you. Gerry, we have a question for you about academic appointees who do not comply with the vaccine mandate. What will happen to them?
Well, I think the mandate applies to everybody. There is no category of people who are not subject to it. So an academic appointee, just like any other, will have to comply. You certainly won't be allowed to teach if you haven't taken the vaccine, and you won't be allowed to elect to teach remotely instead. I think the truth about this mandate, and I just think it needs to be stated and understood, is that it's not optional. It isn't recommended. It isn't even strongly recommended. It's required, and people do have to do it.
Great, thank you, Gerry. Melanie, I'm going to ask you a question about non-affiliates on campus. And the question is, how will we be monitoring if non-affiliates are vaccinated or not, or will we even allow them onto the campus?
So we have some very restrictive, I would say, visitor policies for the fall, which are up on the COVID-19 website. So I think we won't have the same number of non-affiliates as we've had in the past. And there are protocols in place regarding the requirements that they have to go through in order to access campus. So those who access campus regularly will be submitting information, I believe, regarding campus access.
Yeah, it's great, and I'll just add 2 comments. So the visitor policy does say that if you are going to be on campus 4 or more days during the semester, that you need to be vaccinated. And in addition, we have a number of you have asked about what about vendors, and we have implemented and are implementing a vendor policy, and sort of breaking vendors into 2 categories. There's some that are here quite often. They may be working in cafes and coffee shops or in other public safety. A lot of our public safety officers that are not our employees are vendors. Those will all be required to be vaccinated. We have had conversations with the various, what we're calling sort of high impact vendors, and they will be attesting to their vaccination status, and they will have their own separate green screen that will allow them access to campus. One other question that came up quite frequently is there seems an appetite about events for the fall. And we've all been working on the events. Events for CU affiliates, meaning faculty, staff, researchers, and students. We want to see continue, again, subject to the WAFA's description of the monitoring plan. We really want to limit the number of non-affiliates because it is hard to determine whether or not they're vaccinated and adhering to safety protocols. So we do have an approval process. We hope by early next week to have an event policy up on the website that will give you more information. But You need approvals in order to do that of several individuals, including all the way up to the provost. Wafaa, I'll turn to you. What percentage of fully vaccinated individuals have had breakthrough COVID infections?
We don't have those information as available in terms of, because we don't have those available for the country overall or for the city overall in terms of the rates of infections amongst vaccinated individuals. You can assume from the data that I showed you that the rates of hospitalizations and death are very low amongst the vaccinated. So those are the data that we have available to us. I want to caution some people about something as well. For many of you, because I saw how the large numbers of you that are vaccinated, I would assume that most of the people you know around you are vaccinated as well. And therefore, there's kind of, you're going to hear about people around you who have been infected because most of the people around many of us are amongst the vaccinated. So I think just to keep that in mind is that it may give you the wrong impression that there are a ton of infections amongst vaccinated, but that's because of the bias of who's around us, who we know.
Great, thank you, Wafaa. Gerry, a couple questions for you. One is an individual, obviously we're going to mention names, but because of age and health, might be interested in getting an exemption from in-person teaching. How should that individual handle that request?
So there is an exemption process from the vaccine requirement. And if you're eligible for that on either religious or health grounds, you can be exempt from the requirement, and that puts you into a different category. But there is no process under which people who are not exempt from the vaccine mandate are able to change their teaching status. We're going to an all in-person model. There are some courses that have always been taught or will be taught online because the university has elected to teach them, the school has elected to teach them that way in this particular instance. But I regret having to say there is no ability to elect a remote teaching model as an alternative to teaching in person.
Great. Gerry, and then a similar question, I've answered a few in the chat box as well, but is the question of, does Columbia support remote work, and how are the decisions being made in terms of flexibility with respect to return to what we call the new work environment?
Yeah, so the answer is yes, we definitely do support remote work where it's appropriate. And the determination of where is it appropriate is being made right now at the local level. That means by the school or the department. So we have a university-wide conversation underway about how the schools and departments are going about applying these new rules to create the right kind of work environment. And there are some differences. It may be that you're in a school that takes a slightly different view about which jobs can be done remotely, and from another school that has a slightly different view. But the differences don't seem to be large. For almost everyone, there is an understanding that where work is to be done remotely, it means remote in a hybrid model in which you spend some days a week on the campus and some days working at home. Final point to be made about this is we all understand that this coming semester is something of an experiment on the new work environment. It's a pilot program. We're all going to learn what works and what doesn't, and we're going to adapt to it.
All right, well, thank you. Wafaa, I'm going to turn to you because we have a question about boosters. This question is from an individual who has gotten both of the Sinopharm shots. Those are World Health approved, but they did come back to the United States and were able to get a single Pfizer shot. That's not what we are recommending on the campus, but nevertheless, this individual did that. And the question is, should they get a second Pfizer shot now?
I think, again, this is a whole, there's a lot of ad hoc people doing kind of ad hoc interventions. I think there are no recommendations that at this point in time that are relevant to what somebody like this should do. So it's unclear. There are no recommendations. We don't know whether it's needed, whether it's recommended, and whether it's safe.
Great, thank you, Wafaa. There's a question in the box that I will answer because as Melanie reminded you, really everybody on this call ought to just take a moment and look at their Reopen CU app and see whether or not it says that you have signed the compact. You may have signed the compact earlier in the year, but the compact has changed. So the question is, what's changed in the compact? So there are a number of things. Fundamentally, the compact still asks you to commit to certain safety protocols, but it also commits that the university will do those things like cleaning and so forth, contact tracing. What the two major changes are, the vaccine requirement is now in the compact. And so when you sign that, you are attesting that you have complied with that. And in addition, as you've heard on prior webinars, assuming you're fully vaccinated, there are changes in the face covering requirements and in physical distancing. And so those are also reflected in the compact. But thanks for that question. It's a good reminder of what people just need to do. It really doesn't take a long time. Wafaa, there's a question from an individual, and the question is actually an interesting one. It is, when is the pandemic really going to be over? Are we going to declare it, and how will things actually change? And why not go back to, assuming we've got a fully vaccinated campus, why not go back to the way things were?
Well, I think it's a very good question. I think in reality, no one can answer that question. The reason is that as I described before, we have a very disparate access to vaccines. Vaccines are our pathway towards what we call return to normal. Unfortunately, we have, for a variety of different reasons in the country, that people have not, in certain communities, have been reluctant to get vaccinated, and therefore we continue to have within our communities pockets of unvaccinated individuals. This is complicated by the fact that the world is also, there are huge disparities in terms of access to vaccine across countries in the world, and we are an interconnected world. And that makes it also very difficult to get to a point where we have sufficient coverage with vaccines everywhere to be able to stem the spread of this virus. So this is the challenge ahead of us. And that's why so many of us are working so hard to try to get as many people as possible to be willing to get vaccinated amongst our community, but also as much as possible to also advocate for making vaccines available for the world, because I think that's our pathway to getting back to normal. So I think we have a long haul ahead of us. I can see in the foreseeable future that we will have the vaccinated communities like New York City, for example, a vaccinated entity like Columbia University, where we will have a safe environment where most people are protected, but we will continue to experience these surges and blips within the largely causing disease and unfortunately disability amongst the unvaccinated amongst us.
Great, thank you, Wafaa. I'm going to turn to Melanie, who I know is furiously working on the questions. You can see it on her face. But as you know, at Lerner Hall and at the Black Building here on the CYMC campus, we have been administering gateway testing, surveillance testing, voluntary testing, travel testing. And Melanie, the question that comes in is about gateway testing and whether or not you and we will be able to administer gateway tests to perhaps 15,000 or more people in a period of a week or so at the end of August and into September.
Absolutely. We have done it before. We have scaled up. We have the ability to do over 3,000 tests a day if we need to. We're certainly encouraging those who can do their gateway tests in advance of the student return to do so, because it'll be easier for you. You can get an appointment, your lines will be shorter, but we certainly have the scalability and the ability to do high volume testing when we have a mass influx of folks on campus. But again, if you can do it before the end of August, please do so. I also want to add, because I've been furiously typing, just around when you can have same day access and when you can't. We're in what we call the gateway period right now. So right now your gateway testing is not tied to your red pass, green pass. That ends on September 9th. So if you are vaccinated and you're coming for a test now, you can have same day access to campus. If you come September 10th for the first time to get a gateway test, you will still have a red pass, so you won't have access to campus. So it's another motivator to get that test done early now during this gateway window.
Great, thank you. Melanie, can I also turn to you about a subject that I know both you and I are talked about, which is face coverings on the CUIMC campus. And the initial email in June did say that face coverings would continue through the first quarter of 22. Could you advise us about how that has changed since then?
Yeah, so now there is a differentiation between patient-facing areas and non-patient-facing areas. So obviously healthcare settings are very different, and right now, and continuing on through the fall, within those patient-facing areas at CUIMC, face coverings will remain. However, the other areas of CUIMC that are not patient-facing will follow the rest of the university in terms of the face covering, again, with the potential for the indoor face covering for fully vaccinated to be lifted on September 9th.
Great, thank you. Gerry, we have a question. An employee wants to know what is the option that they might have if they do not want to get vaccinated and they also don't believe they qualify for a medical or a religious exemption.
I wish I had a great answer for you on this, but I'm afraid that the answer, it just needs to be stated directly and clearly. There really isn't one. This is a condition of employment at Columbia. If you don't have an exemption, you have to get the vaccination, and you won't be able to continue as a Columbia employee without getting it. I know that for unfortunately on this call, as we saw from the survey, almost everybody on this call is already vaccinated, but there are some of you who are not. And I know what you're thinking is, why does no one hear me? Why does nobody understand that I really don't want to be vaccinated for reasons that make great sense to me? And what I have to say to you is that I know you feel that way, but there's a much larger number of people who are coming back now and in the fall in reliance on our being a fully vaccinated campus. So we have to follow through. And as much as I wish I didn't have to say it, the jobs are on the line here, that this is a condition of employment. You will have to be vaccinated, or you will go through a disciplinary process that could lead to termination as a result of that.
Great, thank you, Gerry, for that answer. Wafaa, a question about the Delta variant, and are you and all of us considering that there might be some changes in policy due to what the data that you were showing around the Delta variant?
Yeah, I think we, as I mentioned with our monitoring plan, we are all the time looking at the data and looking at those metrics that I shared with you and assessing the situation day in, day out. So it's asking the question whether we might change is as always with this epidemic, is that yes, things might change, and we will be on top of the situation to make sure that the findings, the result, the data that are available, the research that's available, the metrics that are available, that we fully discuss these and we contextualize them in the context of what's happening on our own campus, which will be a fully vaccinated campus as per CDC definition, and provide the guidance that's appropriate for the specific context.
Thanks. Melanie, there are a few questions. I'm answering some of them in the chat box, but I think it's worth repeating. There are a number of people who have indicated they may have just gotten their first dose, or they're getting their first dose in August, and they're very concerned about their access to campus. And could you reassure them about how they will be handled during the month of August?
Yes, so long as you have started the process, you will not be subject to any of the discipline or penalties that have been described. We ask that you upload the documentation when you can. I do understand there is a glitch right now. If you've uploaded partial documentation. You cannot yet re-upload, but that is being looked at, so then you can do that. And just make sure that your HR department is aware that of the date when you will be fully compliant with the requirement. But don't worry, so long as you've started the process, you'll be in good shape.
Great, thank you. Wafaa, a question for you, which is somebody who wants to be helpful to those who might be dealing with anti-vaxxers. Where could they find some talking points that they can use to say the vaccine, in fact, is safe, that you still can get sick, and that takes a counter to some of the talking points that are out there amongst the anti-vax community?
And thank you very much for whoever asked that question. I think it is each and every one of our responsibility to be able to have those conversations with people around us and make sure that they have the right information. I would really encourage you to connect to a program here at CUIMC, the Vaccine Champion program, and maybe Donna, you can put the link. I don't have it with me. But this is a group at the medical center here of individuals that have identified this exact issue and have developed materials specifically for people who are reluctant or hesitant, and also who provide training for individuals as to how to have a conversation about vaccination, and try to dispel any misinformation and so on. So I would encourage, we can maybe send the link at some point to all.
I'll ask Robert. Robert can pull it up, and it actually is across all of the campuses. And so we have vaccine champions. We also have research coordinators and ambassadors who are also have been schooled to be able to help with those talking points. Gerry, I'm going to turn to you because we do have a few questions about whether or not faculty can insist or require that their students in their classes, even if they are vaccinated, wear face coverings.
So my understanding of our policy on that is that that's not permitted, that you cannot on an individual basis say in this room, in this environment, everybody must wear masks. I think with the CDC announcement today, I'm uncertain myself where we're going to be on mask requirements. I think Wafaa and Melanie outlined the plan going forward. And if it does appear that we're in an environment in which wearing masks is the prudent thing to do, then that's going to be required. But what I don't think there's room for is an individual judgment case by case.
Yeah, absolutely. And I think we've always said that there's one Columbia plan, and I think there's one set of guidance with usually special considerations for patient-facing settings, but otherwise we apply the guidance uniformly across all of our settings.
Great. I'm going to turn to Melanie for one last question about symptom attestation. As you know, when you sign in every day and you attest to your health condition, one of the questions is about if you have had symptoms that could potentially indicate that you are positive for COVID. This individual frequently gets sore throats, and they're worried because they want to be truthful and attest to the fact that they may have had some symptoms, but they also don't want to get a red pass. What would you recommend?
Sure. So right now there is some logic within those questions. So if you haven't answered them before, you can actually check the box and you get some drop down options that talk about whether or not you've seen a healthcare provider or not. We will be updating that language even further for the fall to give you real instructions. As we know a lot of our population, especially when we're a fully vaccinated campus, may just get a regular cold, not COVID. So we want to be sure that you can be truthful and then get the right guidance, red pass, green pass, depending on it. So it is a little more intuitive than maybe you think. So certainly check the boxes. You don't have to hit submit and you can see what happens, but we will be making updates to those questions for the fall.
And we have another question, and it is a amplification of what Gerry was mentioning, that you cannot ask people to wear masks. You also can't ask your colleagues or your students if they were vaccinated. That's also not appropriate. We will make sure that we are enforcing it as best as we can, obviously through a very a thorough exemption process, but also, continuing to deal with folks who are in that middle area of, I just don't want to get the vaccine.
Donna, can I speak
Sure.
to just it occurs to me the flip side of that question, which is, may I wear a mask if I want to? And the answer is absolutely you may. And lots of us will, I think, just we've become comfortable wearing them and will continue to do so. And to repeat something that I think many of you have heard before, you must not assume that because someone is wearing a mask that they are ill or that they are unvaccinated or anything of that sort. So if you're uncomfortable and feel safer with a mask, that is of course permitted.
Great, thank you, Gerry. Wafaa, a question that actually you were quoted on in the New York Times, I believe. The mayor has mandated the vaccine for city employees, but they do have the option to test weekly if they don't want to get vaccinated. Why haven't we done that at Columbia?
I think there's a very important reason for this, which we are strong believers in, based on the data, that vaccines are extremely important and protect us. And that this is the way of the future, is getting us to be fully vaccinated as a campus, like I said. I think it would be, and the other thing is that, of course, that it's easier said than done to say that the workforce, a substantial proportion of the city workforce, will get tested once a week. It's a huge endeavor, and trying to get 100% adherence with testing every week is going to be very, very difficult. And tracking down people who have not been tested is going to be extremely difficult. So even from a practical perspective, I don't think it's going to be achievable that for the people who don't want to get vaccinated, that they will actually be able to achieve, the city will actually be able to achieve this weekly testing. But the main answer is vaccines are the best tool that we have at our fingertips.
Great, and they help with your family too, your family and your colleagues.
Your family and your loved ones. Yeah.
Yeah. Wafaa, on a lighter note, we have somebody who wants to acknowledge that your flowers are lovely, and I think you probably got them from the farmers market outside here at Haven Plaza, which we have every Tuesday if you want to come up and support local vendors. So with that, I'm going to thank you for your questions, and thanks to the panelists, and turn it back to Gerry to wrap us up.
Just a final word from me. This is a very difficult time that we're entering into. The pandemic has never been easy, but this is crunch time that's ahead, in which difficult choices need to be made, hard questions asked and answered. Not everybody is going to like the answer to every question. I just want you to know that we're doing our best, and that the decisions that Columbia is making are predominantly dictated by public health people, by the three experts, for example, who are here on this call. So please have confidence in us that we are working hard to protect everyone and to come up with a plan that will keep our students, our faculty, our staff, our researchers, that will keep all of us as safe as possible. Thanks, and see you again at another webinar.